With the diagnosis of cancer, it is evidently worrying for the patient and their relative and the family member and the friends. Our task is to give them a bit clarity about it. Of course, not all the cancer is doom and gloom. No doubt it is very intense treatment, and they may experience a lot of toxic side effect on the way during the whole process of the treatment. But you tend to get some good outcome at the end of the whole treatment, and we do have some support staff, nursing staff and support radiographer staff who also pitch in a lot to offer them a lot of support.
So you might visit us in the mould room because we may need to try and keep you as still as possible and reproduce your treatment position when you come for your radiotherapy. It's all in one appointment, so you'll go into CT, you'll meet the mould room team there, we'll make the mask or the back bag what needs making, and then we pass you over to the CT team, so you're not to-ing and fro-ing in between different rooms.
When you come in for your first appointment, you will meet me when you come in for your CT scan or an MRI scan. We'll be putting your marks on, setting you up to get you in the right position to have your treatment. The scan itself, it doesn't touch you, the machine won't touch you at all, it doesn't come close. We just need you to be as relaxed as possible. It does make a little bit of a noise, a little bit like a washing machine really, but nothing substantial. We don't bite. We are just people, we are human, and we understand you're coming into something brand new, and we try to make you relaxed as much as possible and make it a good experience.
A clinical scientist is here to support the safety and the accuracy of treatment delivery in radiotherapy, involved in all aspects such as modelling the radiation, how we're going to deliver it, how we're going to calculate it, and then the treatment delivery side as well, how we measure it and how we ensure the delivery is what we expect so that we get the really precise dose in the right place as we want to treat our patients correctly. The patients are always at the centre of what you do. It might be you're looking at an individual patient CT scan, it might be you're looking at a bigger aspect of the planning system, but all of it you're thinking of how that applies to the patients, how it will optimise their treatment, will it model a real patient correctly, can it deliver? So they're at the heart of everything we do. We joke that in physics we always measure bits of plastic and things, but they're all there to simulate real people and to make sure everything's fine for real patients.
We aim to support the patient throughout their treatment. And that's emotionally as well as physically. So we deal with the side effects that they're having, but we also help them come to terms with their diagnosis and their treatment, and we can signpost other services if they're struggling, if they need more help. So it's quite a big room where the LINAC is. So the LINAC's the linear accelerator that delivers the treatment. It's got a couch in the middle of it where you'll be lying down and having your treatment. And then we'll be manoeuvring you to get you into the right position. But then we have to leave the room to deliver the treatment and to take the images because that's radiation being delivered, and obviously we can't stay in the room. So we then leave through those doors that then close, and we're just the other side of that wall, and we have cameras up that can see you at all the time. So if there's any problem at all, you just need to wave and we come straight in.
I think the centre's a really welcoming place. It's a beautiful building. We aimed for it to feel more like a home from home as you enter into the building. There's comfortable seating, the reception desks have been designed to look more like maybe a hotel reception than a hospital reception. You'll meet friendly staff when you go in for your treatment. As we've said, if we can make that room look as less clinical as possible, then hopefully you'll have a relaxing experience. And the thing that we really do pride ourselves on is caring for the patient. World-class radiotherapy that we can deliver here now. So that should reassure patients that they're getting exactly the same as they would if they went across to Newcastle, they went to Leeds, they went to the Christie. It's the same treatment that you would get here in Carlisle.
Everybody that's here, everybody that you would meet coming into radiotherapy, we're all here to help you. Anything that you need, whether it's little or large, and you might feel like it's inconsequential, we could make a difference. We could be able to help answer that little query just that makes your life much better and much more manageable. Don't be afraid to come and see us. Don't be afraid to ask any question, even if you think it's silly, because believe me, you won't be on your own. There'll have been patients that have gone through this exact same system as you have, and we'll be able to help you in any way that we can.